Hi everyone, my name is Rosie Martinez and I am currently working as a medical assistant. I work in Illinois and I work in an outpatient clinic that specializes in hematology and oncology. I have been in this position for about 20 years now. Not in the same clinic, but in healthcare as a CMA. Um, One fun fact about myself is that I am currently a boy mom. I have two dogs. They are Pomeranian Chihuahuas. That's Pablo and Biscuit. And I have a 4-year-old little boy who is Cruz. And I am currently in my third trimester. I'm pregnant. And I will only be a boy mom until December, January. And then we will be welcoming a little girl. So that's one fun fact about myself. And now I'm going to go ahead and open up my instruments. So one thing I'm noticing is that a lot of these do look alike, but they have small little differences, or actually large differences. So I'm going to pick 4 different instruments and say what I think they're for. I think this is maybe some type of retractor for the abdomen, maybe to like hold and pull. I would think that maybe the name of this is like retractor. I think it's used to pull the abdomen and keep it open. Probably for some type of colon surgery, or maybe like some type of chest surgery. That's where I think on the body it's used for. Maybe it's used by like a general surgeon, perhaps. This, I would think it's similar to maybe like a tenaculum. I would think it might be used for something like a cervical procedure, maybe a LEEP or a colposcopy. And yeah, I think it's probably used for some type of procedure that's done vaginally. Of course, I think that these are like, you know, like a tweezer, like a pickup, a tweezer. That might be the name of it. And it might be used for something in your abdomen or another part of the body to maybe pick up and stabilize small tissues. It might be used for all types of surgeries, abdominal, a hand surgery perhaps. And I feel like this might be some type of suction tool. It might be used to suction maybe blood or fluid in the abdomen. Maybe it like hooks up to something. And it might be used again in the abdomen. Oh, it does open up actually. You kind of screw it back together. Yeah, I think this might be some type of suction, maybe used in the abdomen, for some type of, or even like irrigation maybe, for like the appendix or something like that. So those are my 4 instruments that I chose to talk about. A lot of these do look alike. Maybe this is like a needle driver holder. I'm not sure if that's what they're called. These all look like tweezers. This looks like a tweezer that's missing the other end of it. But that's what that might be. I guess I'll learn more once I start reading and doing different exercises in the workbooks. This looks like an actual scissor to cut tissue perhaps. Again, these look like large tweezers. Pickups, tweezers, I'm not sure what they call them, but I guess I will learn along the way. Let's look at our cards, our flashcards. This is a lot of cards. Kind of nervous that I'm not going to be able to memorize all these. Scrubby's flashcard pack. A lot of different cards. Alrighty, so Let's pick up 4 different cards. It says surgical specialty, general surgery. I think these are the different specialties. Oh, spinal surgery, endoscopic surgery, ENT surgery, plastic surgery, OB-GYN. And let's take a look at these cards. What is the name of this instrument? What type of tissue is this instrument used on? This just looks like a scissors with the gold little tip, with the gold handle, I'm sorry. I would think that they're scissors, long scissors perhaps. And I would think they're used for cutting maybe like an internal organ. So let's see what it says. What is the name of this instrument? And it is a medicine ball, scissors. What type of tissue is this instrument used on? It says it's used for dissecting delicate tissue. Yes, this is logical. It's not strange because it does look like a regular scissors that we would use every day, just fancy with the gold little handle. So yes, this one doesn't seem strange at all. Let's pick something else. What is the name of this instrument? What category is this instrument? This looks like, I would say this looks like something used to deliver a baby. But these edges seem very sharp, so I'm not so convinced that I'm right. It has a little indicator on the handle, like a blue and white stripe. That might be like one of the surgical team's preferences. So the back of this says that this is a Gelpi retractor. What category is this instrument? It's self-retaining, very sharp. So this does seem strange. I don't think I've ever seen this. And it does look very, very sharp, as you can see right there. Okay. Let's try another card. What are the names of these instruments? What are they used for? These I've never seen before. It doesn't look like there's any kind of metal used here. It looks like it's mostly plastic. It looks like it says in sulfate. It looks like it might be a cap for something. It also looks like it's a pencil, but I know it's not. So it says that these are disposable 5 mm and 12 mm laparoscopic trocars. What are they used for? These are used on laparoscopic procedures to create a passway into the peritoneum. This will allow endoscopic instruments and scopes to enter the peritoneal space. So that does sound right. I have heard mentions of the Da Vinci and laparoscopic surgeries, and this might be something along those lines. Lastly, what is this instrument? What are 3 alternative names for this instrument? And so for this, I would call it a tweezer. I would call it a pickup. And I would call it a surgical pickup, or a tweezer. So this says, oh, this is called a Ferris Smith tissue forceps. What are 3 alternative names for this instrument? Ferris Bueller, English, and Big Ugly. So that's that. That sounds right. Tissue forceps, that sounds like what it is. I think that I just keep calling it tweezers because that's what beauty product women use to tweeze their eyebrows. What are my impressions and what are my thoughts? I am very nervous to have to memorize all of these instruments. Nervous yet excited. I'm sure that it will be a lot of work to memorize these instruments. And this is just a pinch of them. There is a lot more. But again, nervous yet excited. So it was nice to meet you guys. Thank you so much for watching my video. Bye-bye.